So I can go ahead and share my screen now.
Yeah, you can go ahead and start sharing your screen and I'm going to introduce you. So I would like to welcome Dr. Mallavarapu. He completed medical school at Andhra. Did I say that correct?
Yeah, Andhra.
Andhra Medical College in India. His residency in internal medicine was at Mercer in Macon, Georgia. His fellowship in nephrology was at the University of Virginia, and his transplant fellowship was at Duke University. He's currently an associate professor and transplant nephrologist at Augusta University, and he enjoys empowering patients and community through education regarding transplantation, health, and wellness. And I do want to say he's asked us to hold our questions till the end, but we can, you can put your questions in the chat, and that way we can answer them all at the end. So welcome so much. We're so glad to have you today.
Thank you. Can you see the full screen?
Yes, it looks perfect.
Great. Okay. Good morning, everyone. It's great to be here and have this opportunity to speak with you all. And thanks to GTF for organizing this wonderful conference. In my talk today, I will cover the various steps in the pre-transplant area on the road to getting a kidney transplant. No conflict of interest in relation to this presentation. So as many of you know, with dialysis treatment, a machine filters waste and extra fluid from your blood. And dialysis only filters blood during the treatment session and not in the constant way a kidney does. For this reason, dialysis patients have fluid and diet restrictions. They also need an access like a catheter, fistula, or graft for the dialysis process. Whereas a kidney transplant is a surgical operation to give a functioning human kidney to someone whose kidneys have stopped working or are close to failing. A kidney transplant does all the normal functions of a normal kidney. Transplant patients do need to take medicine on a daily basis to keep their transplant functioning. This kidney is removed either from a living donor or from someone who's recently passed away, a deceased donor. Transplant patients have less and many times no dietary or food restrictions. So the benefits of a kidney transplant are a better quality of life, better quantity of life, longer survival, more like your own kidney than being on dialysis. It's not as time consuming, obviously. You just have, once things are stable, you have a few visits per year to your transplant team. Fewer dietary and fluid restrictions, like we talked about, and the potential to return to work or school more easily, better growth in children with advanced chronic kidney disease, more freedom to travel, improved fertility. One thing it's important to remember is that transplant is not a cure for kidney disease. It is a treatment option like dialysis, whether it's in-center or home hemodialysis, peritoneal dialysis. And there are some risks to the transplant procedure as well. Surgical, being on medications lifelong with some side effects. There's a risk of post-transplant diabetes and infections. But overall, for most people, transplant is a better option. You have several types of transplant: a living related, living unrelated, a deceased donor kidney. And after understanding benefit and risk of this process, proceeding with a kidney transplant is a voluntary choice. Some introduction to how kidneys are matched with recipients. If someone is a blood type O, they can only get a kidney from type O blood. So O is called the universal donor. Type A can get a kidney from someone with type A or type O blood. Type B can get it from type B or type O blood. And AB blood type can get a kidney from someone with AB or type O, so the universal recipient. We also do finer testing to learn about the uniqueness of each individual. So we test for HLA or human leukocyte antigens. This is also called tissue typing. These are antigens found on many cells of the body, but mostly on white cells. And so you'll hear about this PRA test, which we do to test the recipient's blood against purified HLA antigens. And this is to detect antibodies against these HLA antigens. What that tells us is how sensitized a recipient is, which can make it harder to, a higher level of sensitization can make it harder to find a compatible organ donor. You'll also hear a term called cross-match as you get nearer to your transplant. Again, your body makes antibodies, which are produced by the immune system to attack foreign substances like bacteria and viruses. But a patient also makes antibodies when they have infections, they get a blood transfusion or have a transplant or pregnancy. And so it's important to test these antibodies, as if someone has antibodies to the donor kidney, the body will attack that kidney. So this cross-match test is done before the transplant to make sure the transplant can move forward successfully. Cross-match is done by mixing your blood with cells from the donor. And if the cross-match is positive, there are antibodies against the donor, so that person should not receive that kidney. Cross matches are obtained several times during preparation for a living donor transplant, and a final cross match is usually done within 48 hours before the transplant. So what are the advantages of getting a living donor kidney transplant? You don't have to wait on the deceased donor list for years. Transplants last longer, to 15 to 20 years or longer. Everything can be planned very carefully. Surgery is scheduled electively. And there's a minimal time from removal of the kidney, many times next door in the OR to the transplant surgery. In this process, centers do a very thorough evaluation and screening to make sure it is safe for the living donor. In general, a person can live a healthy life with one kidney. It is hard to predict exactly how things might happen in the future. For example, someone who donated develops heart disease or diabetes many years down the line, that might lead to kidney disease. So future risk of kidney disease exactly is unpredictable. So donors need to stay as healthy as possible, preventative medicine, keep all providers informed that they have only one kidney, and many have a great life. Why would a donor be incompatible with a person? So again, antibodies, your body's reaction to others' genetic markers. If a recipient had a previous transplant, pregnancies, or blood transfusions, antibodies can be generated, and sometimes that makes a person incompatible with a donor. So avoid transfusions from potential donors. Keep your coordinator informed of any transfusions and sensitizing events, as we call them. And work with your nephrologist to keep your hemoglobin level healthy so you don't end up getting transfusions while you're in the evaluation process. So what are the steps in the process to get your transplant? First step is to find a transplant center. And you need a referral by your nephrologist, but many don't know you can self-refer yourself. You call the transplant center and you can self-refer yourself. Of course, your medical history and all that can be sent after that. And then you get to know the transplant team. You come for the transplant evaluation, where you meet the whole multidisciplinary team and then go through a process where you're evaluated with tests. And then the next step is to get on the waiting list and wait for a match. And finally, the call, the organ offer, and then transplant surgery. So these are the steps. Excuse me. So the first, up to the evaluation process, can take 2 to 4 months or longer. Sometimes in the process of evaluation, some tests might come back that need further testing or procedures. And then after you're on the list, that can take several years. It depends on the blood group. Of course, if living donors are available, things can move much faster. Anybody whose GFR or kidney function is under 30 can be referred for evaluation. But for someone to be listed for a transplant, GFR needs to be under 20. You can check out different centers. There's a website called srtr.org. Deb will give you some links if you're interested at the end, which I gave her. You can go to this website and actually search for US transplant centers by organ and zip code. And you can see how many transplants they performed and compare their outcomes in adults and children over the past year or the past several years, and make your choice. Of course, distance from where you live is an important factor in choosing a transplant center as well. You ideally want to be able to reach the transplant center within 24 hours of being called for a transplant. Some other factors like insurance coverage, certain centers might have slightly different acceptance of different insurances, and of course the experience of the transplant team, which you can study. So you're going to have a multidisciplinary transplant team, and that's the nice thing about transplant medicine, is it's great teamwork. You have the primary nephrologist, your nephrologist, a transplant nephrologist, a transplant surgeon, specialty physicians to whom we may refer you for consults, cardiology, pulmonary, depending on what conditions you may have, a pharmacist, a registered dietitian, a pre-transplant coordinator who is your go-to person to be in communication about everything and who will coordinate all your testing, licensed social worker, a finance coordinator, and then for your potential living donors, there's a living donor coordinator and an independent living donor advocate who is an advocate on this for the living donor to make sure it's safe for them. And advanced practice providers in most centers are an integral part of our teams. So the transplant coordinators organize the evaluation, prepare the patients for transplant. Financial coordinators work with the transplant coordinators and insurance companies to make sure that the finances are in order throughout the transplant process. So what is the general recipient evaluation process like? On the day of evaluation, you get a thorough history and physical, several labs, some basic imaging studies. Most people need cardiac testing, like an echocardiogram and a stress test, to make sure they're in good condition to go through major surgery. A registered dietitian will meet you one-on-one. A social worker will meet you one-on-one. Our finance coordinators will meet you. The pharmacist will meet you. You go through in-depth education, and you're given resources to learn more. After that, one thing is to be up to date with all immunizations, dental evaluation for certain candidates, so there are no dental infections or problems. Everyone needs to be up to date with age-appropriate screening, like a pap smear, mammogram, colonoscopy. Each center may have slightly different criteria for these, but in general, your primary care doctor is usually in charge of getting all these done for you. So you may already be up to date, or you may have to get up to date with certain tests. Based on the results of the initial tests, further testing may be required. For example, if someone has an abnormal stress test, that might lead to a cardiology consult or a heart cath or something like that. Social work and finance evaluations are an integral part of this evaluation process. So we have to ensure that you have good support, a good support and transport plan for you to come for the transplant and for you to come to visits after the transplant. And they'll do an in-depth one-on-one session with you, going through your overall understanding of your illness and your dialysis history, compliance, any mental health problems, level of functioning, any drug history, smoking, alcohol usage. So they do this in great depth, and it's very helpful for success with transplant. So, for the first few weeks after transplant, you're going to have visits up to 2 times a week. You'll need someone to drive you to the center. And then, they'll evaluate your out-of-pocket expenses and look into your insurance, have a plan to get all your medicines for you after the transplant. And also, for the first few weeks, having someone to help care for you at home is in many instances very important. Your social worker will talk to you about any resources available and eligibility for those resources, like programs like those which GTF helps with. So as you can see, there's a lot going into the evaluation process, and all this is, in the end, we discuss the benefit and risk in each individual. There's, there has to be a durable caregiving plan, ability to tolerate medications, good functional status in general, so you can recover well after transplant surgery, stable mental health, stable cardiac function. Sometimes the recent history of cancer affects this process. A recipient has to have a good implant site for the surgeon to put the kidney in, and that is part of the evaluation process in checking that out, and then a good transport plan. Contraindications to receiving a kidney transplant vary from center to center, but non-compliance or non-adherence with medical therapy, dialysis, unstable cardiac disease. Of course, some of these can be treated. Severe pulmonary hypertension or oxygen dependence may be a contraindication in some centers. Current smoking or recreational drug use. Severe vascular disease, blockages in the blood vessels, in the extremities, active infections, open wounds need to heal completely before one can go through transplant evaluation successfully. or recent treatment for cancer, an exception being non-melanoma skin cancers. In such cases, many times after transplant, the recipient just needs frequent dermatological visits. Unstable mental health and lack of adequate insurance coverage, which is again something that can be worked on. Some other things like acute or chronic liver disease that might need further evaluation. If it's severe, then a liver transplant along with a kidney transplant is needed. Obesity, this body mass index cutoff varies from center to center. Again, that is something that you can work on. The registered dietitian meets you, gives you a goal for weight loss and helps you with strategies to lose weight. And then you can, once you reach that goal, you can proceed with evaluation process. Financial and insurance concerns can be worked on and ironed out. Mental health can be stabilized. With history of cancer, depending on the type of cancer, there can be a wait time because of the kind of medicines we use after transplant. Immunosuppression medicines can increase risk of cancers coming back. So certain cancers have a longer wait time. And then social support. So what happens after the evaluation? There's a selection conference where the multidisciplinary team, physician, surgeon, the whole team, pharmacists, all of them give their input. And we review all the results, determine your risks, and then the center determines if they're a transplant candidate at that point. So they could be declined if the team really feels that the risk outweighs benefit. Deferred, meaning there are certain things that need to be worked on, or accepted to move forward. We talked about this. Declined or deferred could be from infection, recent cancer, just incredible risk with major surgery, problems with an implant, finding a good implant site, reaching a BMI goal, inadequate post-transplant plan to take good care of yourself, or non-compliance or mental health instability. If accepted for a transplant, of course, the coordinator will call you with results, and there may be certain recommendations that need to be completed. A key thing is to keep the transplant center informed of your progress. Your coordinator is your go-to person, and ask questions. Ask, where are you on? What else needs to be done? Are you active on the list? So being in touch with your center and with the coordinator is a key thing. And this is your opportunity to plan ahead and confirm your support. Remember that you're going to have some lifting restrictions for 4 to 6 weeks after the transplant. You're going to have some driving restrictions. So you need a solid transportation plan, usually about 4 to 6 weeks, depending on how the surgery goes. Having a partner who can 24/7 commit to helping you for that first month, longer if it's a simultaneous kidney pancreas transplant. That partner should be there when you get inpatient teaching after the transplant about how to care for your transplant. Plan to get time off work. Think about the distance from the center and how you'll get there. Think about any medical equipment that might be needed. Get the finances in good order. Think about how you can get to your outpatient appointments after the transplant. All the planning ahead really helps make it a success. So when do you go on the list? Once you have completed all recommendations, a current blood sample to check for any antibodies, insurance authorization, and then registration with the United Network for Organ Sharing, UNOS. One thing to know is that data at the time of listing and after transplant is reported to UNOS for regulatory purposes. So what are the waiting times? This is for waiting for a deceased donor kidney. Average wait time depends on blood type and the antibody level. Across the USA, these are approximate numbers and they change from time to time, but average wait time is 4 to 5 years across the US. In Georgia, they have been a bit longer with blood type A, 3 to 4 years, AB, 2 to 3 years, and O and blood group O and B have a longer wait time of up to 5 to 8 years. Certain blood type B candidates may be eligible to get a kidney from an A2 or A2B blood subgroups. But your center will inform you more about that process. How are organs distributed? There's a point system managed by UNOS, and so several factors go in. How long you have been waiting on the list. The start date from when you started dialysis counts and you accrue time from that time once you're on the list. So they go back to the day when someone started dialysis to calculate this time. The antibody levels, somebody who's very highly sensitized, has high antibody levels, finds it harder to find a compatible match. And so those who have very high antibody levels are put higher on the list because it's so hard for them to get a match. A prior organ donor is prioritized on this list. Pediatric age group is prioritized. Degree of match with the donor, of course, and the size of the donor kidney as compared to the body of the recipient. All these are factors that go into matching the organs to the proper recipients, so it's a success. So what can you expect on the waiting list? Like, it is a tough time. You have to keep yourself healthy. You may be in an active status where you can get a kidney any day or get a call and you're available for donor offers. So we check that PRA antibody level periodically, which the dialysis center can do, or if you're not on dialysis, you can go to a lab and get it sent to the center. If you're in an inactive status, you're still on the waiting list, you're accruing time. Usually PRA tests are not needed. You continue to gain waiting time. Either way, you have updated testing every 1 to 2 years at an annual or a reevaluation visit with the transplant center. Whereas once you're active on the list, you have to be ready to be transplanted at any given moment. You should be able to be reached at all times. Very important to have working contact numbers and voicemail boxes that can receive messages so the center can contact you. Always inform your coordinator of any of the following, like insurance changes, phone number changes, address changes, changes in your health, changes in dialysis. You change dialysis modalities. You went from PD to HD, or hospital admissions, infections. If you're traveling for a long time somewhere, keep your transplant center informed. So when you're active on the list, if, just as we talked, if there's a change in health status, always get in touch with your coordinator. Or if there's some change in your support plan or transport plan and you can't travel to the center, let them know so they can help you work that out. And of course, centers also can be made aware by your nephrologist or communication with the dialysis center. What about multiple listing? Once you're active at one center's wait list, you can think about the option of multi-listing in another center in a different organ procurement area to increase your chances of getting a transplant. Some points to be remembered are: make sure you think about the distance from your home so you can reach the transplant center in a short amount of time, or the required time. The specific time needed to reach the center depends on that center, so each center can tell you about that. Generally, patients need to reach the hospital within 24 hours after you're contacted about an available kidney, or much earlier, ideally. And of course, you should be able to have follow-up appointments, whichever center you list with. So in summary, a large multidisciplinary team will be working with you to make sure your transplant is successful. There will be blood draws, appointments, and procedures to be done to be considered as a candidate for transplant. Getting on the waiting list takes a while. You're not on the waiting list until you have been approved by the transplant team at the center. Transplant is one of the treatment options, and in most cases, it is the best treatment option for advanced chronic kidney disease. But there has to be a discussion of benefit and risk, and it has to be an individual risk and benefit assessment. And it is an elective procedure. As you know, many of you are aware, there are risks with all surgeries and invasive procedures, especially under general anesthesia. Your transplant team will go into more detail about those. There will be lifelong immunosuppression medicines and periodic labs. For example, even someone who's been transplanted 10 years ago still goes every 3 to 4 months and gets their lab work done and their medication levels checked after this. So you're at the center of this whole process, and the whole multidisciplinary team of providers is here to help you. And with teamwork, we can get a successful transplant and a new lease on life. Thank you. With that, we can have questions. I hope that was helpful.
That was very, very helpful. I especially love your little dancing kidney bean at the end with the hat on celebrating. That was super cute. And we did have a couple questions come in through the chat, so I will start with those. But I will also invite you, if you want to unmute yourself and ask questions, you may, or you can put your questions in the chat to everyone and I will go through them. So first, do you accept test data from other hospitals, or do you want to do your own tests?
Most centers do accept test results from other hospitals which are updated.
Okay.
And many times we don't have to duplicate those tests. Certain blood tests need to be done at each center's labs, but many of the imaging tests can be accepted. Like it's not unusual to get a CD from another center of an imaging test or a CT scan. But certain centers can ask that certain particular specific tests might have to be done at that center. Not usual. Most centers accept other centers' tests.
Okay.
Dr. Ravi, hi, I'm
Yes.
Linda Simmons.
Hi.
You touched on it a little about the B may get the A, B, a kidney. I had to be tested. I'm on the inactive waiting list right now because I had breast cancer. But they had me get work. And it was something about the antibodies. Can you tell me a little more about that?
Yes. So B blood type patients can get an A2 donor kidney or an A2B kidney, but only if they don't have a high titer of antibodies against those blood types, subtypes. That's why that testing you had to go through to get those antibody levels. If each center may have a slightly different cutoff, but we want those antibody levels really low for the transplant to be a success. If the antibody level goes over a certain amount, like 1:16 or 1:8, then it can be, the test can be repeated. Was it a one time and it's back to normal? And that helps the center. Yeah.
So it was something they said I would have to continue taking until I get a transplant. So I wasn't sure. Does it mean that my antibodies was too high or they was too low?
It's just that, so antibody levels can change over time, and they're unpredictable. So the center has to keep testing you every few months to see if those antibody levels are going up. There's just no way to know. Somebody who had a 1:8 level this month could have 1:16 after 4 months for different reasons. That's why the only way to know is to test. That's why they have to test.
So it could be that if you get a blood transfusion or a what they call it, it's a blood transfusion, and then you get like the frozen plasma. So
yeah,
that can change your antibodies, correct?
that can, yes. Getting a blood transfusion can change it. Whether and then after some time, whether it'll settle down is the question. So getting it tested over several months will help the center. Yep, you're right.
Thank you, Dr. Ravi.
You're welcome. Thank you.
There is a question that says, if I am inactive, GFR is 14, but not on dialysis, am I moving up on the list?
You have to be active to get a kidney. So until you're active on the list, moving up and down won't matter. But so the first step is to get active on the list by completing the requisite recommendations. The GFR being 14 or 16 won't affect that.
We also had a question about how long is a kidney viable in a deceased donor?
Good question. Up to 24 hours, max 30 hours. So they come, some come from long distance on a perfusion pump and on ice. So max I've heard of center stake is about 30 hours. But most prefer like that 18 to 20 hour max, 24 hour max. Obviously, the shorter, the better. Yeah.
Okay. I don't see any other questions. I do want to invite you to unmute yourself if you have any questions. Oh, here we go. The follow-up question to the deceased donor question was, the person was thinking specifically of auto accident victims, no ice, in reference to the deceased donor.
Like, what is the exact question? Can you clarify a little more?
Oh, yeah. Oh, you got to unmute yourself.
Are they viable? How long are they viable if somebody just dies before they get, refrigerated? How long is kidney viable?
It depends on the type of accident, what happened to that person, the blood supply to the kidney. Is there any bruising to the kidney itself?
Yeah.
So there are a lot of variable factors here. But the kidney is usually put on a pump, and then there are certain parameters they look at, and a biopsy is also done in most instances to check if everything looks okay. And then the surgeon visually also inspects the kidney to make sure there's no injury from the trauma that would make it impossible to transplant. But
Thank you.
the time varies depending on what kind of trauma it was, and how severe the trauma was.
We have another question coming in, and that is, what is considered a high antibody in your blood?
Over 90% or over 99% is very highly sensitized, but over 90 is up there. Each center varies on their definition of this to some extent, because what medicines you get right after the transplant. Also, some centers, if you have a higher antibody level, they might give you a stronger medicine right after the transplant. So some centers might say 40%, some might say higher. But to be prioritized on that list, it's, under the highly sensitized category, it's over 99%.
Okay, here's another question. I would like to know, if you had cancer and it's over 5 years since you had the cancer, how quickly will they call you for a transplant?
So depending on the type of cancer, there's a wait time. Usually after 5 years of being cancer-free and not on active treatment, you can proceed with evaluation right away and go through that process in most centers. Hope that answered that question.
All right. I don't see any other questions coming in. And I do want to be respectful of your time today. So just one last minute, anybody have any questions? I know we have a lot of thank you. This presentation was very informative. We're glad we're here. Here we go. I got a letter from my surgeon for cancer-free, the person.
Great. Awesome. Deb, I sent you some links, which I think they'll find very helpful.
I will. So after the conference, I send a follow-up email with the copies of the recordings and a survey. And I will also send links, ways to contact different centers or Georgia Transplant Foundation. And I will also include that link that you sent me. It was very, very informative. So I'll make sure to everyone who is at the conference today gets a copy of that as well.
Great. Thank you. It's great to be here, and have a great one.
All right. Thank you so much.